In June of 2021, so after the whole COVID nonsense, I lost my practice. I had to close my office down because I was not considered relevant in the work world. Even though I did pain management and I did health, nobody gave a rat's ass. In the state of Florida, a medical myotherapist, they don't even know what the hell that is. You can't even fight with the lobbyists in the medical world to say, hey, look, I'm a hybrid. There's not very many of me around. So I lost my practice, got pregnant, had my kid, decided I was going to go back when he was 3 months old, and started working back with the athletes that have been begging me to work on them. And several of them had gotten vaccinated. Now I knew this, but I wasn't aware about the level of mRNA that was in the vaccines at the time. What I knew is with the flu vaccine, if any of my patients had the mRNA in it, which they all did, they had to wait 2 weeks before I would work on them because there was 3% mRNA in most flu vaccines, which that is transferable for about 2 weeks through cross-contamination. So same as like if they had a epidural for a spinal pain, I wouldn't work on them for a couple of weeks because that can cause the person to go paralyzed if you're spreading it in the wrong direction. Cortisone shots, like there were certain contraindications that I worked through, and a flu vaccine was one of those. So having them had been vaccinated, the last one that I worked on, he'd been vaccinated in March. Okay, so I got 3 months. We're good, no problem. I worked on this patient, we'll call him patient A, on Monday. He came every 2 weeks, hell or high water, rain or shine, he was always there. On Tuesday morning, I woke up and my tongue was swollen, had cracks all down it and blisters in the back. I actually have a photo of it. It's disgusting and I'm not willing to share it, but I do have a photo just for documentation. And I had a spinal headache. So the left side of my spine, all the way up in here, was grinding pain. I've never had a spinal migraine. I've always had migraines here or in my head or in my face, but never in my spine. My left finger, my ring finger, which still does not straighten out, excruciating. Almost 20 years of working on people that were 6'8" and 380. I'm 5'4" and 120. Never. My hands never hurt. I was raised a fisherman. I was pulling in nets and anchors and all that kind of stuff as a kid. I have man hands. I can grip the hell out of anything. Never have my hands ever hurt in general. And that left knuckle, excruciating pain. And then my left ankle. I didn't have a fever. I didn't have any other symptoms. It was the weirdest thing. And I thought maybe it was an allergy, that I'd eaten something and maybe it inflamed my joints. So 3 days later, I got over it. I ate coconut oil and swished it, did oil pulling in my mouth in order to correct my tongue. I did beamer therapy frequencies, all the stuff that I knew in order to help the human body. I did all those things and I recovered. It was fine 3 days later, but I had to go back to work. 2 weeks after that first initial appointment, client's back. This is how I figured out who did it. The next morning, woke up, same exact problem. Identical. I'm like, this is not okay. Something's severely wrong. It's not even oak pollen season. Like, this doesn't make sense. So I got better. 2 weeks later, same client, same exact problem Tuesday morning. I was like, all right, I'm out. Yeah. Hands on the person for 60 full minutes, utilizing coconut oil or jojoba oil, some sort of conduit. But I used it because it was clean. It didn't have parabens and all those other things. But coconut oil, jojoba oil, they're conduits. I know that anything in your body is in my heart in 126 seconds as a therapist. I'm aware of that. That's why I take mass amounts of immunity builders all the time. And it's a dangerous business to be in because you are touching people for an hour at a time. And for me, I was doing 6 to 8 hours a day. So it's chronic. But I had one consistent patient A, that I worked on those 3 days, the following day getting sick, who had been vaccinated and had told me, I realized this had to be an mRNA problem because I am sensitive. I'm very, very, very sensitive to chemicals. So when I was working with anybody who had a flu shot, I had bad reactions. Not necessarily my tongue swelling, but I would have flu-like symptoms. So this was like COVID-like symptoms, but without the illness.